How do you put an epidural needle into somebody's back without accidentally going too far? So when we're doing an epidural, one of the first things we do is actually feel the patient's back. We're feeling for these little bony bumps down the middle of the spine, which are called the spinous processes. And in particular, we're looking for the spaces in between them because that's where we can start advancing the epidural needle. But the crazy part is we don't actually see where we're going. It's all done by feel. As you advance the needle, we're constantly feeling how much resistance there is. And as the needle is passing through different layers of tissue, we use a syringe to gently push saline as we go. And then at a certain point, when we reach the epidural space, that pressure causes the resistance to suddenly disappear. And that's called a loss of resistance technique. So it's like imagine you're pushing the syringe against a brick wall the entire time, but then when you finally get to the epidural space, that resistance gives up and all that saline gets pushed out of the syringe. Because you're pushing against firm tissue and ligament the whole time, you only get that very obvious loss of resistance whenever you reach the epidural space. So we're not just blindly sticking a needle into somebody's back and hoping for the best. And we don't even necessarily need any imaging like ultrasound either. We're using the patient's anatomy, what we can feel with our hands, and the change in resistance at the needle, all of which tell us exactly where we are.